We have Mike on the phone here. Does he count for quorum if he's on the phone?
He does.
Hey, Mike.
He's physically here.
Sorry about that. I hate to cut you short.
Recording in progress.
But I would like to call to order the meeting of the Public Safety Committee for Thursday, March 16th, 2023. And welcome to everybody who's here. First item of business is public comment. Is there anybody here who wishes to address the committee? And Brittany, are you aware of anybody online who wishes to address the committee?
I am not.
Okay. Let's see, any changes to the agenda?
You got an email about something?
We were going to have some representatives from the Trumansburg and Dryden school districts, I think, Sheriff, but they're not coming today. Is that correct?
It was Dryden and Newfield schools, but no,
Newfield.
they're holding off for now, Rich.
Okay. So we are not going to have that change to the agenda. Pardon me. There was something else.
It was a resolution.
Is there a new resolution to add?
There was a budget adjustment and transfer for.
Oh, just the budget?
Okay.
Okay.
Okay. Minutes approval for February 16th, 2023. Could I get a motion? Ann moves. Mike seconds. Any questions or comments on the minutes? All right. I'll call the roll. Mike?
Yes.
Ann?
Yes.
And the chair votes yes. I'm calling the roll because I don't know if Veronica or Lee are going to appear remotely. I do have, I see we've zipped up to the chair's report, and I had a document I wanted to share, but I can just walk through it. This is regarding the jail task force, and I just wanted to make the committee aware of, let's see, of what it looks like we're going to have the jail task force do. And Lisa, I think I copied you on that email. Did I?
I don't think I received it.
All right. Shauna prepared a charge, and it's fairly short, so I can read it. A task force will be established to listen to community, those with lived experience and law enforcement needs, in order to design a building that will accommodate our community priorities. A recommendation will be provided by the task force to the Facilities and Infrastructure and Public Safety Committee on how to proceed forward with the estimate for a new jail/public safety building, i.e. space, number of inmates, structure type, location, and services offered. And so this is where I did a draft, proposed actions of the task force, and I have 6 items. The first is conduct meetings open to the public with an opportunity for public comment. 2, organizational meeting to review the charge to the task force, current jail design, previously prepared designs, current capital program, that's for the stuff that's going on now, and the report prepared by the Public Safety Committee on jail functionality. 3, meet with the Magistrates Association to gain input on the cap court and what functions they wish to have available in the jail. 4, meet with the CJATI Advisory Board on what functions they wish to have available in the jail as they relate to programming outside of the jail and in transition. 5, meeting with individuals who have served time in the Tompkins County Jail to receive their input. And 6, prepare a report out to the F&I and PS committees. So that's the draft. I had shared that with Mike and Travis for their input, but I'd welcome any comments or questions you guys have. Does this sound reasonable? Ann?
Sure, yeah, I'd like to thank you and Rich and everybody else who's going to be serving and helping with that. It sounds to me like a great place to start is gathering input, and especially from the community. So thanks for making sure that that happened or is happening.
Is happening. And the one thing I would like to make sure is that we continue moving forward with the process, because I don't want this to just drag on and on. I'd like it to come back to our committee fairly quickly. But there's a lot here, so we'll see how fast we can move. Mike, did you have anything?
Brought it read fine.
Okay. I have not heard anything further from Mike Lane or Travis, so, anyway. Oh, and here's Lee. Okay. Give him a moment to come in, but Lee, we were just talking about the jail task force draft agenda. I don't know if you had a chance to look at that, if you had any questions or comments.
We talked about it a little at facilities this morning.
All right. Was there approval involved, or was it any questions, any changes?
They're aware that you're in the process of putting it together.
Okay. And Travis has identified a few community members to serve on the committee, so he is in the process of getting their agreement to help us. Next item on the chair's report is rescheduling of the May committee meeting. And Brittany, you have a training on the day of our scheduled meeting in May, is that correct?
That's correct, yes.
And so we were going to look at alternate dates. I can't remember, did we propose an alternate date?
Let me pull them up for you. We have May 11th at 3, May 23rd, or May 24th at 3. May 11th is the week before it would have been scheduled for, and then the 23rd and 24th are the week after.
You guys have access to your calendars? Does May 11th work at 3 o'clock?
That's the date that facilities agreed to move back to as well.
Oh, okay.
So say Lee's going to be here in the morning anyway, so.
All right.
I have a conflict on the 11th,
At 3?
but not on the other two.
Okay, what was the next date?
The 23rd and 24th.
Right, the 23rd? Yeah. May 23rd at 3 o'clock. Tuesday. It would be. Ann?
For me.
Okay. Why don't we tentatively schedule it for that date? We'll see if Veronica, if it works for her. We'll go from there. Okay. Next up on our agenda is County Administration. Lisa, welcome.
Thank you. Thank you, Rich. Just a few quick updates from County Administration, may be of interest to this committee. We are in the process of reviewing and interviewing candidates for our Homeless Services Coordinator position, and that's going very well. So that process continues through this month. And then in terms of the Reimagining Public Safety, there are several plans underway and groups convening. I wanted to make folks in this committee aware of the community healing event that's coming up, hosted by the CJC on Tuesday, March 21st from 10:30 to 1:30 at Cinemapolis. Will be led by Dr. Angel Acosta and is free and open to the public. And
What time is that
That's
again?
on the 20, oh, that's the community one.
the community healing, yep, 10:30 to 1:30
On the 21st?
first.
Was that the one that we got an invite to?
Yes.
For some reason, I thought it was, oh, I'm sorry, my calendar's still on May. So in May, I'm available on that day. Sorry, go ahead.
And then we recently put out some information about the co-response model that has been, there's been a lot of work put into this with our whole health, mental health department and sheriff's department. And both the sheriff and undersheriff are here as well. I think Frank was going to tune in, and Mona is here to provide any further updates about that project in particular. as that moves forward. We are trying to recruit candidates, practitioners in the mental health department for that role.
Okay, that sounds exciting. Sheriff, is there anything you wanted to add on that one?
No, I just want to remind everybody and those who may be watching, our co-responsor, our care team, stands for Crisis Alternative Response and Engagement. And its purpose is to provide a comprehensive mental health services to persons in mental or behavioral or emotional crisis. And our goals are to try to match mental health services to a person in crisis by offering possible alternatives to emergency petitions such as 945 orders. And right now, we're hoping the team will handle a variety of calls, which include obviously any involving somebody in a mental health crisis, suicidal person, a person with an emotional or mental health disorder, or somebody that's disconnected from behavioral health services, any call involving an intentional overdose, a person with an emotional or situational crisis such as a family conflict, and a death-related or critical incident in order to provide support and stress management. We made a lot of headway under Sheriff Olin has led the charge from the Sheriff's Office, so I'd like to thank her. And she's been working with Harmony on Frank's team. They've been great. We have somebody identified in the Sheriff's Office to move forward. We have a female deputy with 18 years experience that, although she just transferred to our office this past year, she's very experienced and very interested in this type of work. We also have a vehicle getting prepped for such purposes, and basically we're ready to go, I feel. Frank is still working with his group to identify a mental health clinician to partner with us, but once that's done, I think we're going to be in good shape. We've also met with Doer to set up how these calls will be received and dispatched. So again, I think we're in really good shape. We're excited to start this and can't wait to see it hit the ground running and see where it takes us.
All right, Frank, our special guest star today from the Health and Mental Health. Do you want to say anything about this?
Well, just to reiterate what the sheriff said, I appreciate Under Sheriff Olin and Harmony in my office have done the heavy lifting of putting the program together, and we're excited to get it launched. Really the holdup now is identifying a clinician, and we're currently advertising for that, and we've put out a lot of public information around it. So if anyone knows a licensed clinical therapist that would be interested in this type of work, please send them our way because we're anxious to get this launched.
Yes, Mike.
Just a quick question. We had a shortage of mental health workers in the mental health department, so much so that I think at the end of last year we actually had to cut hours and things like that. Has that issue kind of resolved itself where we're able to fill those positions? And if so, are the new people we're looking for the same kind of mental health workers? Like, do they have the same kind of, is the job description similar from a qualification standpoint?
Yeah, so to answer the first question, Mike, yes, we are back to full operations that occurred, gosh, almost a year ago now. So we're back. I believe we're fully staffed in the clinic at this point, and we do have a couple of folks out on medical leave, but we're in a much better place there. There certainly is still a challenge in finding therapists. So we're continually recruiting and looking for additional help. These positions have the same job description as the clinicians in the clinic. We're looking for, our title is licensed clinical therapist, and there are particular licenses underneath that job description that the Office of Mental Health requires. And anyone that has one of those licenses would be eligible. The ad that has been placed is very clear that these two positions are to serve as part of the care team and serving in this unique capacity. So yes, the job description is the same, but the recruitment is clear that we're looking for folks to work in a different setting.
All right, thank you.
Ann.
Thank you. Glad to see so much progress made, and we're getting so close to having this alternative response available. And so, two questions. So this will be if say, someone in the community has a need in those categories, they would still call 911, correct?
Yeah, it would still, and the only way we can actually receive calls and funnel them without causing all kinds of craziness is to have them funnel through the dispatch center. They would be able to call 911 in an emergency, or they can call the administrative line, and then they would be dispatched through our records management system like all other calls. And if you recall, that's also the same method that we currently use with our sheriff clerks. And, you know, having been through the process with trying to work with dispatch and setting up our sheriff clerks, that made it a lot easier in this aspect as well with this team. So yeah, right now that's the way that we'll receive those calls.
I'm actually really glad to hear that, because otherwise, how are people going to know there's a different number? So I know this is extra work and training too for the Department of Emergency Response. So thank you. But to me, it makes real sense. One number, because people don't have to learn another number, or if someone's here from out of the county. So I'm glad to hear about that. And just a question about the car. So the car, is that going to have lights? Is it going to have, you said different labeling on the car?
Yeah, it's going to be set up with a lot of the same equipment, because, you know, we need to have that equipment in an emergency situation, so we don't want to do away with all that altogether. But yes, it will be marked differently. It will be distinct from our other marked patrol units. But we also want people to realize that there is a law enforcement personnel in that car as well. So yeah, it'll be much different. It's going to be white. We're working on the design of that now. We've been bouncing back and forth some ideas between ourselves, the health department, and Dominic. So we'll hopefully that'll get resolved here pretty soon, and we'll be good to go. But I just wanted to, on your first question, point out that one reason we want the calls dispatched that way and put on our same records management system is so they're on the call screen with all our other calls as well, because it's important for our shift supervisors, our sergeants, to be able to see what's going on with all our members at any given moment. So they will have the ability, just like with our sheriff clerks, to switch a car. If a regular car is set initially, that a sergeant could pick up and say, hey, I think maybe that's better call for the care team or a sheriff clerk, and they can do that kind of switch on the spot. So that's why another reason it's so important.
Great, thank you.
Lee?
Do you have a projection how many calls you think the team may be responding to?
It's kind of hard for me to say that right now, but I know with the different call types that I just read out to everybody, a lot of calls we receive definitely fall within those categories. As I've mentioned many, many times, a lot of calls that come in one way end up having a drug or a mental health component to it. So I believe, and all I can say at this point, Lee, is I see this car being very, very busy. But, you know, we can search, as you know, in our Spillman records management system, every call that this team goes on. So we'll be able to provide up-to-date numbers by the day or by the week or whatever we need to show how many calls that unit actually responds to. That'll be very easy for us to do.
I'm just kind of raising that because I have my suspicion how busy they could potentially be, and there may be some budgetary implications if it's as successful as we would hope it to be.
Yeah, and exactly, Lee. And, you know, we got to keep in mind, too, this is going to be on the road for 8 hours out of a 24-hour period. So it's going to get used, I think, pretty heavily.
I would expect that if it is successful on 8 hours, that you're going to want to look to expand that.
Well, I'll leave that for a future discussion with the legislature, but I can certainly say that, again, I think it's going to be utilized quite a bit, and I think we're going to see that in a relatively short amount of time once we get this up and running, and I definitely would hope that we could all study this, see how it is. It is a trial program, and you know, if we think it's benefiting the community as much as I think it will, I hope that we can at least be open to those conversations.
Thanks, Sheriff.
Okay, Ann?
Thanks for letting me ask another question. Did you say the hours that this kind of pilot is going to be happening?
Yeah, I think, Jen, are you on the call still?
Yeah,
We had this conversation.
Yeah, Harmony pulled some of their stats, and it was determined that it would, right now, Monday through Friday, 10 a.m. to 6 p.m. would be the most beneficial time to have this team available.
Okay, great. Thanks for letting me know.
And that will overlap 2 of our shifts, which will be nice.
And Jen, I just wanted to ask, did you have anything you wanted to add?
No, just I appreciate all of Harmony's work with me, and we're excited to partner with Mona at the CJC to come up with what data they'd like us to collect and how we're going to evaluate the success of this program. And also thank you to Dominic to help design the logo. I think we've kind of agreed on a logo, so we're excited to get that vehicle marked with that, and just looking forward to getting the program up and running.
Yeah. And I note that Michael Steitley's here with us. If you wanted to just come up, because you're going to be a player in making this happen, or your department. I just wanted to give you a chance to comment and make sure emergency response is ready to go on this as well. It sounds like you are.
Oh, absolutely. I just want to thank the undersheriff for the collaborative approach. We were looped in the very beginning. We had some suggestions, and they fully embraced our ideas. So I think that what we have set up, we're going to be ready to go when they're ready to go, and we're just excited to be a partner in it.
And what's your sense on call volume?
It's really hard to say, in part because the way we screen a call, sometimes in the past, it would have just been coded as a law enforcement call, and sometimes it gets coded as a medical call. But because of the way we've set up the call unit in the system, we'll be able to drill down on data pretty quickly for them. And so we'll be able to know exactly when we're sending a unit.
Okay. And I had a question. I know we're getting a crisis stabilization center coming online, and I assume this would dovetail with that facility pretty well, but I wanted to give a chance to comment on that to anybody. Is that the case?
I think, Rich, our response, the way we respond to calls historically, we had very limited tools to do that. A lot of them may involve an arrest or a 941 order to the local hospital. It's my hope that services such as that and others will provide a resource to give us more tools to refer that person to if they need it. So yeah, I certainly going to be helpful.
Yeah, and I met with Angela Sullivan maybe a couple of weeks ago and took the tour of their new Alcohol and Drug Counsel building, and we discussed the partnership that we will potentially have with this co-responder group. And as soon as we identify the team members together, we plan on having a meeting with local stakeholders and resources that we think will be helpful for this team to be aware of, and we would like to bring them all in a group together and kind of, discuss the best way to pass on the resource and potentially have quarterly meetings. So I think they'll definitely be a good partnership.
Yeah, no, this is really exciting. I believe that we are, I hope it all works, but we're really doing the right experiment. That this is what we should be trying to do, is to reach the people that need help and get them that help and get the right tool, right? The Crisis Stabilization Unit, the Alcohol and Drug Counsel, Detox Center are just great additions to what we'll be able to offer. So very positive. Okay, anything further on this subject? Lisa, sorry, it was your report.
No, but it's definitely a collaborative effort, so that's, thank you. I think the only other thing just to note on that, and for this committee's awareness, that the program will serve the jurisdiction that the sheriff's department serves. The city is exploring different options and for a potential model that they may use, which may involve peer support, and looking at levels of staffing with IPD and what they can work with going forward. So we're continuing conversations with them to stay apprised, and the DOER team is aware of that in terms of dispatching and resources.
Well, certainly, if we get this online, we can get a very good sense of how well it's working.
Yes.
And hopefully that it would expand from there. So, yeah. Okay, anybody else on this subject? Veronica?
Yeah, apologies if this was said and I missed it, but in addition to this program, which is really exciting, is there any sort of mental health crisis emergency response that does not also include uniformed armed law enforcement, like the mobile crisis team used to be? Maybe this is a Frank question.
Yeah, so to be clear, the mobile crisis team does not respond without law enforcement now. And it's important when we talk about the word crisis, we define it as someone who's immediate threat to themselves or others. And so in those instances, we have to ensure that our staff are going into a safe situation and have the appropriate supports, which is why we partnered with law enforcement for that. I see this co-response model as a piece of the continuum puzzle, right? I think there is still opportunity to talk about response to community situations that don't require law enforcement and may not even require a licensed clinical professional. Lisa just mentioned peers as a potential option. So I think there's still conversation to be had about the alternative response continuum that we need to have, but in these instances, our intent is to address those folks that are truly in a mental health crisis, where they're a threat to themselves or others, where we need to make sure that the people responding are safe as well. So that's the thinking, and I do believe that there's much more conversation to be had about a full continuum of alternative responses.
Thank you.
Okay. Actually, I'd like to go a little bit out of order and bring up Department of Emergency Response next, because we have a couple guests with us today. So, yes, please. And welcome.
Thank you.
Michael?
Absolutely, thank you.
Would you?
So joining me today are two of my newest colleagues. Well, actually, Danielle has been with the department actually much longer than I have. But today is with me today is Joe Milliman, our new EMS program manager, who started last week, and Danielle Schwartz, who's been a member of our dispatch team for about 7 years. And she is going to be our new data analyst and working very closely with the CJC and also handling all of our discovery requests. Her position will completely transition probably into the summer, because she's agreed to stay on and help us train our next 3 dispatchers. And that's really pretty critical for us right now to make sure we get those seats filled. So I just thought it was nice to bring them down and introduce them to the committee to help make their positions possible, and how much we want to just extend our gratitude for that support.
Well, I wanted to make sure you knew you were very welcome in your new roles, and I'd give you a chance to just share some thoughts if you have any. Don't want to put you on the spot, but.
Nothing at the moment. Kind of getting adjusted to the new role, but I do look forward to seeing how we can find some gaps in our EMS system and help improve that.
Joe, since we've talked so much about alternative response, and just in your experience, Joe is a paramedic, comes from Groton and worked with the Groton Fire Department, but he has a tremendous amount of experience, not just locally, but throughout the state. Do you see where EMS could also eventually play a role, if not maybe even some of the services that we talked about today, maybe helping to decompress some of the responsibilities that EMS has by having some of these alternative response models?
Yeah, absolutely. I mean, just having the opportunity for them to respond in a timely manner sometimes can just help with that gap.
So typically, the 911 center really has one of 2 options: either we call EMS or we call law enforcement. And although we have crisis intervention, it's typically paired with one of those 2 anyway, and typically law enforcement. So I could see how some of these new initiatives could certainly help in our EMS community as well that's struggling. And Danielle, I'd like to point out that, as part of the interview process, I asked our candidates to look at the TomStat report, and I asked them to helped me reinvent that, because I think it's a very public-facing document, and Danielle did just a great job. I think she's got great vision, and one of the things that I mentioned to her, Rich, was you really focus in a lot, for example, on the drug overdoses, and how can that data be presented at a different level, at a much higher level, as opposed to just a number in a column. And when she did her presentation during the interview process, what she came up with, I thought was extraordinary. So I'm really excited to work on that. It was just because there was a lot of vision, and she put a lot of work into it for the interview. So I'm excited about that, and I think all of you will be excited about it too once we are able to roll that out over the next few months.
Okay, well, we will expect extraordinary then. No high bar there.
No pressure. Welcome.
I have a couple comments. To the data analysis, there's so much information coming through emergency response that impacts the whole public safety system. So this is a great step, I believe, that we really haven't gotten the knowledge out of it. We have a lot of information, but we haven't really turned the corner to make us smarter, at least as smarter as we should be, if that's proper English. So that's, I think, just a great forward step. And Joe, as you know, this past year we committed to fund this position, and this is a new step for the county, and that we typically or traditionally, historically, have not been involved in EMS services. But I believe this is a place we should be, and this is a key element to trying to figure out how do we get there. I would note that I sit on another committee, the Budget, Capital, and Personnel Committee, and we're talking about trying to rethink how we do our budget process with trying to get the major initiatives identified earlier in the year. Typically, we've waited till the fall, but this is something I think we can see coming, and we're talking about trying to at least have outlines of things in April. But where we go with this EMS county involvement, I think we probably want to start having those discussions earlier rather than later, so we can fit into this budget paradigm. So a lot coming pretty quick there. So yeah, anybody else have any questions, comments for our new people? Okay, all right. Well, why don't we cover the rest of your report?
Actually, that's pretty much what I had to report on today. Did you have something you wanted to?
I absolutely have something else. Where was it? Pardon me for paging through. On February 28th, the overnight shift into March 1st, ESD Josie Castillo was recognized by Dispatch Supervisor Brian Bowman for doing an excellent job remaining calm while talking a caller through childbirth, how to tie the umbilical cord, and staying on the line until the ambulance and 093 arrived. Wow.
Wow. Josie's fantastic. Josie and I started right around the same time, and I'm sure Danielle can even attest to just how fantastic Josie is as a 911 telecommunicator, and we're real proud of the work she does every day. But this particular event obviously stands out, but it also illustrates that most people don't necessarily have a real appreciation for what the 911 telecommunicators do, and this is just an example that sometimes we coach people through childbirth and make sure that they're safe, and we stay with them. Even though we're not there in the room personally, we're there with them emotionally, and we're living that emotion with them.
I would imagine you get to the ends of some shifts and you wonder what just happened. What is 093?
Oh, 903. Okay.
What's 903?
Can you come up to the mic?
Ithaca 903 is one of the engines for IFD, so it would have been a co-response between IFD and then Bangs as well.
Okay.
I would not have been able to answer that.
Okay, anybody else? Veronica.
Yeah, that stood out to me too, so I'm glad you brought that up. I could be misremembering, but I think Josie was one of the people on shift when the three of us actually went up last year to visit emergency response.
That's correct. You're correct.
And she, she talked to me some through how you decide like when to stay on a line or not for a call, and I would trust her to talk me through an emergency.
Yeah, she's fantastic. Thank you. Thank you for mentioning that.
Are we pressed for time this meeting?
We are not pressed for time.
Oh, great. Can I ask a couple of random questions?
Yeah, please.
One, just because a constituent asked, do you track, or does anybody track traffic accidents that are a result of winter conditions specifically?
Well, I might have to ask our new data analyst, how is it added into the CAD system? Is it added as a motor vehicle accident, or do we typically attach some type of a weather element to it?
At this point in time, we don't have the capability to attach a weather element we've got two different categories for car accidents. We've got the property damage, which involves just strictly property damage with no injuries to the individual. And then we've got the personal injury, which is a motor vehicle accident with some kind of injury component with it. So we don't have any way for differentiating. We can have a litany of call comments within the ticket. I believe that there's advances coming down the road where we may be able to filter out, to your point with overdoses, where a true overdose versus something that's categorized that's not truly an actual drug overdose. So right now we don't have the means for it, but it doesn't mean that down the line we won't have a way to filter that out and report on it.
We've just invested in a module for our CAD RMS system. It's basically the system that we use to interface with our first responders. It's a data replication software package that will allow us to collect data at a level we've never been able to collect it at before. It's a brand new module. We were using an add-on program before to do that. So the reason I bring that up is, as Danielle mentioned, we can maybe put a call comment in a narrative box, and our hope is that we're going to be able to actually search that, that free text field. And so we could say, where we could maybe, if somebody noted that it was because, they struck an animal, or, if there, for weather conditions, or at least track it by day where we knew there was poor weather events. But, one of the reasons why when we decided to create this position and have it be an internal promotion, you had to have been a dispatcher with our department for at least 3 years in order to even apply for it, is because our data is very complicated, and to interpret it without having that background would be very difficult to train somebody to do. And, obviously I would not have been able to answer that question at the level she was because of her experience in entering that data into the system. So thank you, number one. But, I think it's just important to point that out, because as we begin to share data, especially with the CJC, and I've already been in contact with Mona about, Danielle meeting her team, I think it's going to be really important, because she'll be able to help them interpret the data that we put in, because it's different than the data that the police department or the fire department or EMS puts in when they're finished with the call. What we dispatch a call as and what it's eventually cleared as is completely different. So we might put something in as a drug overdose, and then when the officer gets there, say as an example, they might say, oh no, this was a burglary, and then they give it a completely different code. That's not really a great example. I'm being, giving an extreme example for a reason, but so sometimes our data isn't the best data to look at to say, well, we've had this many overdoses, but she'll be able to help those community partners understand that. So I didn't mean to take your time, but I just thought it was important to point that out.
Awesome, thank you.
Okay, and Jen, I see your hand up.
Yeah, I could just offer something to that. If law enforcement responds to a traffic accident and completes an accident report using our TRACS software, whether was a contributing factor to the accident, we note that. So we might be able to pull that data from our TRACS system.
And it's a great example of what I mean by the disposition code, or how somebody else. Thank you, Undersheriff.
Okay, and did you have more?
I did, but you can go first if you want.
I was just going to, since we were talking about it, the overdose poisoning line, again, is month on month. We've just seen very high numbers. And I would express a concern that with the problems we're having with fentanyl and now xylazine as essentially additives to the opiates or substitutes, I'm afraid that we are heading into sort of uncharted territory, because you have people that are actually seeking out these more powerful drugs, and they're highly dangerous to people who aren't used to using them. So as the potency of the drugs spreads out, I'm not quite sure how we respond to that I mean, we do the best we can, but I'm afraid that these high numbers we've seen are just the beginning of a long stretch of high numbers. I'd welcome any comment. Somebody tell me I'm wrong. Lee?
If you read the Syracuse Post-Standard, there was a story in it Sunday about the alarming number of xylazine-related emergencies in that county. It's not that far away from us, and it's on top of the fentanyl issue.
Yeah.
And it also, I think, speaks directly to the increase in call volume that we're seeing that EMS communities experiencing as well, because those obviously are, or, you know, their aggregate numbers changing, but also because there are more critical calls, getting somebody there quickly so they can give things like Narcan, for example, if it's appropriate, is important. So I think, you know, it has a ripple effect across the emergency services spectrum.
Well, I guess we'll go from there. Veronica.
Yeah, I guess kind of on that note about the numbers, sometimes I like to skim through these numbers and see if anything looks really different in the current year month and the 5-year average. And the couple things that jumped out to me now, where it says transfer for EMS and transport by police, those numbers seem to have kind of swapped. Like relative to the past 5 years, the transfers for EMS is way down, transport per police is way up. And I'm wondering if there's any kind of protocol policy change behind that, or if this is just random.
Do you mind speaking to that since you often code these calls?
A lot of the...
Can you bring the mic?
Sorry. A lot of the EMS calls, as far as transfer, in my experience at least, is usually bangs, where they will do a transfer from hospital to hospital or hospital back to a residence. In my experience with working, bangs can have a difficult time with staffing, so that may impact their availability to do the transfers. As far as the law enforcement transfer, again, the sheriff and undersheriff can speak to it better than I can, but we have seen, when I work in the daytime a little bit more, we have seen an increase in the transfers, and that could be somebody being taken from the jail to a court appearance or to a medical appointment. So I don't want to speak out of turn, but I think that perhaps corrections and their staffing may have an impact on the numbers that you might be seeing, because we might be pulling some more transport numbers for law enforcement, where we typically had just added it in a radio log where it hadn't actually created a ticket itself. So that could be where the different numbers are coming from.
And I see the sheriff and Jen has her hand up. So either one, jump in.
Yeah, no, that's exactly right. You may recall recently we shifted the responsibility, or the majority of the responsibility for prisoner transports to our road to help with our jail staffing. That was one of the emergency decisions we made. So historically, when a jail staff member would conduct a transport, they would just notify dispatch via the radio, and they again would just mark it on a radio log instead of creating a call for it. Now that our road patrol is doing the transport, it's getting an incident number, which I am assuming is what you're seeing is the increase in transports is due to that.
That makes a lot of sense, thanks. So these are they're not really requests for help with a thing, just notifying the whole
Yeah, it's simply taking someone to a court appearance or a medical appointment, so they're notifying dispatch that they're leaving the public safety building and en route to their end destination.
That makes sense. Thank you.
And what we'd like to see in our new TomStat report as we start to build that out, where you can see service calls, so that would be again something that would be a little bit more obvious, because the way it is right now, it just it does require explanation. So we're hoping that the end reader can look at it and say, well, I clearly understand what this is.
Hey, Lee. Oh, Veronica, did you have more?
I had one more on a different line. So.
Well, why don't you go ahead and finish up, and then we'll go to Lee.
Yeah, the other line that stood out to me was the probation line. Has the 5-year average calls as 1, and this month is 84. What does that even mean?
So just recently, in fact, I'd ask maybe Dan to even add some additional comments. So prior to a few months ago, we weren't tracking the activity of the probation department. They were pretty much just sort of operating in their own. So about 3 months ago, Dan, I believe I saw you, we added them to the county radio system, and very similar to the way we dispatch other emergency services, we're also tracking and pulling numbers for the probation department now. The most important thing about this new relationship with probation, though, is the safety piece for the folks that are in the field, because now they have radios that they didn't have before. We're doing safety checks on them the same way we would with our other emergency services partners, and because of that, that's why the average is, that's why it's listed the way it is, because it's only a few months old.
Sense.
I just want to make sure I properly represented that.
Okay, Lee.
Just want to pick up on something with Veronica's question on the EMS transfers, and it's great that Joe and Danielle are here, because I know this is an area they're going to have to look into as they go along. And I just would point out that it's an indication of a broader problem within the healthcare side of things and with the hospitals. And they are transferring patients all over the region, all over the state, not just Cayuga Medical, Cortland, Auburn, all of them, because of specialty care and overcrowding and so on. That, in effect, and these numbers are real. They're big jumps from where we were 5 years ago, and it is putting a stress on the EMS system, because the commercial ambulances are constantly trying to scrape together people to do these transfers from the facility to facility. And that is rolling out into stress on the broader system. And that's one of the reasons that we wanted to see this position created, to start to look at that. So you've pointed out an area that is very much a strong concern, but it extends beyond emergency response. So we look forward to hearing more about what your analyses and ideas are.
Yeah, I completely concur with Lee. Because a consequence of that is that sometimes the crews that are used for emergency calls are doing these interfacility transports. So if they're going from, say, CMC to like Robert Packer, and that puts them out of pocket for, say, 3 or 4 hours, and that's not unusual. And if that's a unit that's been typically dedicated to emergency calls in the community, they're not available now. So that may now impact a neighboring community that has to come in and do mutual aid for them. So I think you're spot on, and I think that was a really good observation as well as far as the data. But I think it does speak to a much larger problem. And it's not just here in Tompkins County. It's really a national problem, but we're feeling it here locally.
Okay. All right. Anything further for emergency response? Ann?
Since we're doing a deep dive
Yes,
in these
please.
numbers, I wanted to ask about property checks. We're up just about double, 1,606 versus the average for February, 797. So I just wondering if there was any.
I think that's been up since the pandemic started.
Yeah.
Property checks.
Property checks. I'm sorry, I didn't mean to cut in, but I thought the question was.
Yeah, no, go ahead, Sheriff.
Yeah, the property checks are something we've really amped up in the last couple of years, so those numbers are going to remain high. They are very simple. They're pulling into our school parking lots, checking out a school, checking a business during the overnight shift to look for signs of burglary, things of that nature. So our overnight shift particularly really hits them hard, because often the call volume is much less, and so they're trying to be a little more proactive and checking on businesses and places such as that. So I anticipate that those will remain pretty high.
Thank you.
Okay, anybody else? All right, well, thanks for coming in.
Thank you.
Yeah, do great work. This is really good. All right, let's keep moving. Next up, we have the Sheriff's Department. And Sheriff?
Yeah, thanks, Rich. I just got a couple other things. You saw our report. One highlight in there is we did just recently have our Road Patrol award ceremony at Lake Watch Inn in Lansing. We do that every year. That's where deputies are recognized for certain achievements they've had throughout the year. And awarded for special things they may do. We have a variety of categories. So that was a lot of fun and always nice to get everybody together. The other thing, biggest thing is our jail hiring. I reported last month, everybody on this meeting knows that We took additional emergency actions other than moving the transports like Jen mentioned, but we also offered sign-on bonuses for new correction officer candidates and also collapsed our salary steps to try to recruit and retain our newer employees while we continue to work out a new contract with our jail union. We've been interviewing people hand over fist, getting a lot of good applicants. So the actions we took as a county definitely have worked. We have a lot of people coming on board here in a few days and some more in April. We have a physical fitness test March 25th at TC3. Everybody we've been moving forward with will have to pass that. If they don't, we won't be able to continue moving forward with them. But on a positive note, we've had so many good applicants come in that we can simply replace them if we need to with other new applicants. So it's really positive and hopefully is going to really improve the operations of our correction facility in a positive way. And I think that's all I have right now, Rich.
Okay. I think you will be involved. We're going to have a discussion, I anticipate, in regard to probation about give, but we'll get to that in a few minutes. So any questions or comments for our sheriff or undersheriff? Ann.
I just wanted to say thank you for coming to us with these suggestions a while back, and, you know, that we could help in some small way to help, you know, with the bonuses, sign-on bonuses, but a lot of it, of course, is just stuff that you guys have done there internally, and so kudos to you, and also welcome to your new recruits.
Thanks.
I have not checked the jail numbers statistics in the past week or so. I assume our numbers are still running in the 50s somewhere?
Honestly, Rich, I have not checked this week myself. I've been a little busy. I believe they still are in the 50s. I know, Jen, we were just talking yesterday, I think it was, we have a bunch getting ready to go to state, I know.
Yeah, we took 5 to state prison on Monday, and we have a few awaiting sentencing, but yeah, they do still maintain in the 50s.
Okay. Do you know if we're holding anybody on any technical parole violations or?
I do not know that offhand.
Okay. All right. And actually, this will merge into our next report from our district attorney, but I think you have a pretty ambitious trial schedule through July. I assume that's proceeding along?
It is. So I can answer your question about the parole violations. I think there's 2 people in the jail right now who are there for technical parole violations. So I can confirm the numbers are in the mid to high 50s as of Monday. But there are several people who have been sentenced or are being sentenced in the next couple of days or weeks. So those numbers hopefully will go down. As far as the trial schedule is going, we are just finishing up a city court trial today. And then on Monday, significantly, the Deputy Starner trial starts in Ithaca City Court, and that is a significant trial for the county because this is a sheriff's deputy who has been out on administrative leave but being paid for a long time pending trial. So there'll be some closure with that one way or the other. That's a perjury trial that is happening in city court starting Monday. I personally have 3 trials, May 8th, June 2nd, and July 10th in county court for major felony cases, including a murder case that happened in the city of Ithaca, the stabbing that happened on the 6 Mile Creek Walk back in October. So, and there are other trials that are also on the trial docket. So we are going into the fall very busy. I can talk about give. I think I can wait until we're at that topic with probation, but there are some updates that Derek and I know about that maybe everybody else doesn't. And I'll lastly say that I am looking for a data analyst to work in the DA's office. The job wasn't posted initially when I thought it was. We had a little glitch with HR that is now fixed, and I'm actively looking for that position to be filled that will also work with the data analysts from CJC and from Dewar, and we'll figure out how those positions can work together and not have any overlap.
Okay. Well, I assume that's essentially your report as well. Any questions for our district attorney? Okay. One thing I was going to mention before we left the Sheriff's Department was there's a very nice letter in the report regarding Deputy Pryor and his assistance with some senior citizens that were subject to a telephone scam that sounds like it was really scary. And I think this is a thing that's been happening across the country, but somebody locally was called saying that their, I think it was their son, had been in an accident and was arrested and needed immediate bail money, and they tried to get these people to send money over the phone. And at any rate, seems like a really cruel scam, but Deputy Pryor helped these people, so well done. Okay, anything further for our sheriff or our district attorney? And we can go to the probation department, which I think has a few different things we were going to talk about. Dan, do you want to start with give?
Yeah, I think that would make sense, and I'd defer to Matt or the sheriff to start that, and I can fill in how it's impacted us.
I'm happy to talk about it to start off the conversation. So GIVE is a program that is run through the DCJS, the Division of Criminal Justice Services, the New York State agency. It is that stands for Gun Involved Violence Elimination, and it has been, I think, conducted or granted to about 18 counties across New York State. Those are counties that have been identified with higher than average gun violence history. And so we were approached, we meaning Derek, Dan from probation, I and IPD were approached by DCJS because we've been identified, specifically the city of Ithaca have been identified as a potential candidate for the expansion of GIVE. And this would be money that's on the table in the form of grants for targeted enforcement, education, things that are related directly to trying to address the gun violence problem, which we've all talked about in recent months, has been increasing in Tompkins County and in Ithaca City. We had a web call a couple of weeks ago, and unfortunately nobody from IPD was involved in that call, despite being invited. We all left the call with the understanding that if IPD didn't sign on and wasn't part of the process, that we would not get this grant money. And I think we're looking at $380,000 in that neighborhood was being talked about. So we all left with the mission of trying to engage IPD. I yesterday was in a meeting with Deputy Chief Monticello and was able to connect him with DCJS. And I think that they had a phone call where Deputy Chief Monticello pledged that IPD would participate and be a part of this program. So I think that's good news in the big picture of us trying to make this happen and be part of the program and get this money. I think probably Derek talked to the same individual I did yesterday. He talked to him about that as well. So I think this is going to happen. The grant money is going to be identified, and we'll have some paperwork to do pretty soon. And I think all of us are ready to do that and make this happen.
Hey, Dan, was it my understanding you were going to submit something from the probation department to try to make sure we didn't miss this opportunity?
Yeah, that's true. I think there's a little bit of a misconception about what's going on. So our first meeting was February 28th that Matt referred to. And then last Thursday, March 9th at 11 o'clock in the morning, by oversight agency, the Office of Probation Correctional Alternatives, which works, is a division of DCJS, told me I needed to be on a Zoom meeting at 2 o'clock that day, along with 3 other counties that they had identified probation departments that they want to participate and give. At that meeting, I was given and told to file a probation budget development document. So I had to submit that by close of business this past Monday. So the conversation I had with the state director was that I would not be able to manage the requirements of this program without 2 additional staff members. And I was very bluntly told, then apply for it. So we put our package together. It involves 2 full-time senior probation officers with salary and fringe, 100 hours of mandatory overtime for the year, a cognitive behavioral intervention program, the cost of 1,080 estimated days of electronic monitoring, because every participant in GIVE that's put on probation is required to wear an electronic monitoring device for 6 months. An employability program cost, travel and training, and officer wellness funding. The grand total of what I submitted was a request for $334,000. I do not believe that represents the entire amount of funding that would be granted to Tompkins County. That was specific to the probation department and what we would need. So IPD, the Sheriff's Department, and the District Attorney's Office will probably be asked to submit similar documents as to what their departments would require in order to participate in GIVE. I was told that I would receive notice by the end of the week whether or not that funding was approved. So because it was such an expedited process and such a push to get this done, I'm assuming that they're very interested in moving forward with the entire county, and I would think that additional funding would, for the other agencies involved, would be forthcoming.
Yeah, having attended the meeting at the Sheriff's Department, the Zoom meeting up there, it did strike me that they were really anxious to get applications and very interested in pushing money out the door very fast. It's just an interesting process that they seem to want to go so quickly. Usually you expect this to be a really drawn-out, slow thing. But I agree with everything you said, Matt, that it would be a lot better, I think, if the city was directly involved, and I'm glad that they're willing to do that. Hopefully that'll happen. But I'd open it up for comments from the sheriff or the district attorney.
Yeah, Rich, as Matt mentioned, when I came in this morning, I had a message from yesterday from DCJS stating that they still had not heard from the city of Ithaca, so I returned a phone call to him, and he informed me of the conversation that he had with IPD, Vince Monticello specifically, when he called Matt. So I don't know where this leaves the sheriff's office. As you know, you were present in the meeting. I am very excited to see this happening. I think we need to do something to address the gun violence we've been seeing. But they were really pushing to have IPD's involvement, I think, rather than ours. I informed him this morning on the phone that, you know, the sheriff's office stays committed to helping with this process. I am concerned with the lack of the city's response to this initially, and right up to the last moment, frankly, that they're going to be able to see this program through. So at this point, I don't know if the sheriff's office specifically is going to have an opportunity to submit a budget, or if that's going to fall on IPD's shoulders. But again, we stay committed to hoping we can be a part of this and hope we can address the issues that we have specifically in the city of Ithaca.
Yeah, yes, absolutely. And I would note, Dan, at your presentation on Saturday, you had some statistics on the uptick in gun-related incidents in the past year, 22 versus 21, and it's pretty shocking. And just, I think one of the things you said was that on any gun-related charge that comes before the probation department, you need to do supervision at the greatest risk level. And so that's what these two positions would be targeted towards. Is that correct?
Yes, that's correct. last June at our state conference, the state director advised all probation directors in the state that he recommended we follow the best practices that have been developed with the GIVE program, that anyone involved in a gun-involved crime be started at the greatest risk supervision level. Our probation department has 2 greatest risk officers currently. Greatest risk officers see their clients 3 or more times a week, so they have a lower number of people that they supervise, but they supervise them at a higher level of intensity. We try to keep them below 25. And prior to changing our practice in July and starting to put all of those individuals on greatest risk, those caseloads were in the low 20s. They're both full now, and 27 of the 45 slots are filled by gun-involved probation cases. We do have a few more in the hopper that may head that direction. So what the grant money would do, if we were to be given a position or 2, would be to alleviate or open up some more spots so that other types of supervision cases could be supervised at the greatest risk supervision level, as well as 2 officers mostly focusing on GIVE clients. There's a lot of requirements that if someone's given GIVE probation, there's a lot of requirements that they have to do that it's going to require an even more in-depth level of supervision than the standard greatest risk caseload because of the cognitive behavioral intervention programming, the employment programming. So it's adding a few layers that we'd be required to do with anyone put on probation for a gun crime.
Okay.
I think the reason that it was really expedited in our case is because OPCA is housed in DCJS, and they're probably all overhearing the same conversations about GIVE, where there's a little bit of a separation. You know, the district attorney's office and the sheriff's department and IPD oversight agencies haven't caught up with it. So we could not do this program alone. If probation's the only one that gets funding, it doesn't make any sense to do it because it's going to have extra demands on the district attorney's office, the sheriff's department, and IPD. So if we get the funding without the full package, we can't do GIVE on our own. That's basically what I'm getting at.
Okay, Matt.
So you were in this meeting and heard me say this, but I think everybody else will hear it too, that obviously DCJS is very concerned with having IPD buy in, but I think the smartest thing to do with this money, if we're able to keep advocating for it, which I will, is to have the sheriff be responsible for the implementation of any programs that are GIVE related, based upon his being in a vast better position, the sheriff's office being in vastly a better position to do that for staffing reasons, for chain of command reasons, for numerous reasons. So that's what we'll continue to do, and I think Derek and I are on the same page with that. I swear I heard $380,000, but obviously with Dan being directed to do what he did as far as an ask for probation, it seems like there's way more than that's available to us as a county. So we're going to be aggressive and keep pushing this to make sure we make it happen. Governor Hochul doubled the funding for this program from $18 million to $36 million. So there's $18 million out there that has not been utilized by the current GIVE counties. To my knowledge, they're trying to add 4 us and 3 other Chemung, Jefferson County, and Cayuga County. There may be more than that, but those are the ones that I'm aware of that probation departments were directed to attend the meeting last week.
Dan, for the benefit of the committee members, would you be able to dig up that slide with the data on gun-involved incidents 2021 to 2022? And in the meantime, Ann, you had a question?
Yes, thank you. I can infer some things, as far as the benefits to the community, but since we're having, a pretty long discussion on this, I'm just wondering, for the community, if you could just state a couple of reasons why this is something worth fighting for, how it will better the community.
Well, thank you, Dan. If you look in 2021, weapons-related charges touching probation, 79 incidents or cases, and 2022, that went up to 113. I mean, we are seeing something significant happening in our community related to gun crime. So I understand why New York State is concerned about this, and we should be concerned as well. And I think GIVE is a real opportunity to try to target a response where we need it, you know. So yes, a good question, Ann, but I think the numbers are directly apply to that. But if anybody wants to speak further, Matt?
I do. One thing I thought was really interesting and significant and encouraging based on the web call that we had was that the GIVE program is really focused on procedural justice and evidence-based practices that seem like it's more of a long-term community-based focus. In other words, we're not just looking to take people and put them in jail. We're looking at addressing the underlying causes of gun violence and looking for long-term solutions. So it seems to me like an absolute win for the community to be a part of this program.
And Dan, maybe you could speak to the part of your grant application had an educational component to it, I believe?
Yes, it did. So estimating that we would have about 30 people a year in the GIVE program. I added funding that would allow for the grant to pay for a BOCES type structured certification program, such as welding, cosmetology, heavy equipment operations, something that would really give people a leg up on being employable in positions that would allow them to support themselves. So the grant would actually pay for these individuals to be trained, which would be, I think, an incentive for a lot of people to agree to participate and also have good outcomes as far as for the individual, reducing their risk of recidivism if they're able to make money and support themselves in a job that gives them that sense of value and purpose.
One thing I would add to this conversation is that GIVE is an annual grant program. And if we're using the money to fund positions at the probation department, the possibility exists that the state would decide not to fund it in future years. And we would have a very hard decision. How do we proceed from there, especially if we're seeing real benefit from having these 2 probation officers working at greatest risk supervision. I think that's a gamble worth taking. It does seem like the funding has been fairly steady for many years until it's actually been increased recently. But just so everybody is aware, this is a yearly grant. I don't know if anybody wants to speak to that issue.
To the best of my knowledge, none of the counties that have been funded with GIVE have lost their funding. I think it would be a really good problem to have to reduce our gun crime down to the point where we don't need to supervise people at that level. And if that were the case, whether it's myself or a future director, I'm pretty sure we could get rid of extra bodies by attrition rather than having to let people go. But that's a conversation that we could have so that we wouldn't have to, if we didn't have the work to do as far as that GIVE involves and the problem subsides, then we could phase those individuals out without necessarily letting them go immediately type of situation. But again, that's a budgetary question for the legislature.
That would be a hard but good problem. Yes. Okay. Anything further on GIVE? Other than that, Dan, did you want to speak to your presentation from Saturday?
Sure, I'll try to be quick in the interest of time. I appreciate everyone's attendance and giving up a Saturday morning to attend. I think it was, we had quite a few of the Justice Court judges there. We had a city court judge. We had Mr. Van Houten, Mr. Salisbury, Mr. John, and it was a nice and a lot of clerks, which was really an important piece. ADA Quinlan was there as well. Had some good conversations about trying to troubleshoot an OCA restitution order that's been handed down that's created some problems for us. There's going to be a work group between probation, the clerks, and any other interested parties to try to resolve those and come up with a workable solution that the forum has created for us. We talked about some restructuring here in the department. Through promotions and moving people around, engaged in the final phase of the restructuring process and actually reassigned all the supervisors here to different units. We had one supervisor who's been supervising 2 sex offender officers and 2 domestic violence officers for over a decade. Very, very difficult work. It takes a toll on you day after day reading those kinds of reports and engaging with individuals who engage in those behaviors. So we relieved her of that and put her in charge of some, put her in charge of city court and our 2 DWI officers, and split up the DV and sex offender caseload between 2 other supervisors. I just recognize that that's too much to ask of any one supervisor to have those 2 caseloads. So we've completed that, sort of the final phase of the restructuring. People are settling in. Our numbers are definitely going up as far as supervisions and pre-sentence investigations. We'd seen, we'll, I guess, discuss it at CJHI, or we could do it here at some point, just how numbers temporarily went down during COVID and how they're now rebounding back in most areas that we're involved in. Also tried to troubleshoot some PSI issues, talked about statewide trends, introduced our new electronic monitoring device that will be for low-risk offenders versus the one we've been using. I think it generated some good conversation and gotten good feedback from it. The one downside, everyone seems to not like having it on a Saturday. And the only reason I do it on a Saturday is because that's the day where I felt it would be easiest to not have conflicts. But some of the feedback I got from the judges is that they have a monthly magistrates meeting on Friday afternoons, and in the future, we might get better attendance if we offer the meeting during a magistrates association scheduled meeting. So that'll make everybody happy that they're already on the clock and, not having to give up a Saturday morning to come to our presentation. So that's what we'll aim to do in the future.
Dan, could you just speak for a couple minutes about the initiative regarding SWAP and how that's being rolled out in the courts?
Yeah, so we noticed during COVID our utilization of community service, our SWAP program. SWAP stands for Service Work Alternative Program. We have 2 full-time employees in those positions, and they take community service workers out into the community to selected sites and perform the community service. The numbers have gone way down during COVID. I think it's a really important program that uses restorative justice principles. I think most of the people who participate in that program get value out of it and are able to give back to the community and see the value in that. So we started a pilot in July where we added 24 hours of community service to every appropriate misdemeanor conviction and 40 hours of community service to every appropriate felony conviction. Those exclude sex offenders, some types of violent offenders, and anyone who has mental health issues or physical health issues that would preclude them from being able to safely participate. So our hours have exploded, the hours that have been ordered. Try and find the slide so I can give you a better number here. It went from hundreds of hours being ordered over the course of 2020, 2021 to several thousand hours being ordered. And we're excited to have bigger community service crews and get them out there doing good things for not-for-profits in the community. So.
Then finally, you had a good discussion about victim impact panels, and I think there were some dates set. If you could share those with the
Sure, I can
members.
share the slide.
Okay. And just to be clear to the Public Safety Committee, we're invited. We can go to these victim impact panels, and apparently it's quite a program. That there was a lot of discussion. Is it Sam Thomas?
Yes.
The speaker is incredibly powerful, and that's June 14th. I'm testing my eyes here, and November 15th this year at the courthouse, and trying to see.
I can see it better if you want me to read it.
Yes, please.
Sorry, the program, we ask participants to be there at 5:30. They're screened through court security. We alcohol test them. Anyone who appears to be under the influence is not allowed to attend, and we would notify the court that referred them that they showed up under the influence. So the dates for this year will be June 14th and November 15th. We also have calendared dates for 2024. During COVID, we were not able to gather big groups of people together. So in October, November, and December, we cleared our backlog by doing smaller panels here. Program speakers are usually the district attorney's office, acute addiction recovery services, alcohol and drug counsel, a presenter from Alcoholics Anonymous, and the speaker who we've fallen in love with, Sam Thomas from Elmira, lost his 4-year-old daughter in a DWI crash. She was in a vehicle that was hit by a drunk driver and passed away on the scene. If it does not rip your heart out of your chest, you've lost your humanity when you hear his story. It's very powerful, and it resonates with the clients. So we've provided the courts now with referral forms that have the dates on them, and we're just going to resume our pre-COVID practices of having the courts fill out those forms, make the referrals, and then we will sign people up and notify them in advance of the panel. One thing that came out of meeting with the judges and the clerks is we'll now attach for appropriate cases, we'll attach our referral page as an addendum or an attachment to any applicable pre-sentence investigation. So that'll be a good reminder for the judges to start the referral process.
Thank you, Dan. Just one other thing I'd mention, there was a discussion from some of the judges contrasting the probation services that are offered here in Tompkins County versus other counties around us. And the discussion basically was that it's very hard to ensure enforcement of restitution and community service orders in other counties. They just don't have the manpower or the structure that we have here. It was quite a compliment to Dan's program. So I just wanted to mention that.
Thank you.
Yeah. Okay, any questions, comments for the probation department? Dan, anything else?
No, thank you very much.
Okay, and Lance Salisbury is with us from Assigned Counsel. Welcome.
Hello, everyone. I don't have actually a lot to report. That's always fun to hear, I know, at the end of a meeting. I sent everyone the email to update you on the one House bills as it relates to the 18B rates. That's an ongoing issue. We'll be monitoring over the next couple of weeks and keep you updated as things change. I'm sure they have to meld basically 3 different concepts, and we'll see where that comes out. I tried to note the different financial impacts there for the county on those 2 bills, but otherwise everything's I don't really have a lot to update other than that.
I have not been keeping track of the negotiations at the state, but I assume we're heading towards an April 1st budget, or is it going to be delayed this year?
I think their goal is still April 1st, but I'm not sure. I think I mean, I don't really know, but it seems like it may be
They're
a
not
little more
asking your
contentious.
advice?
I mean, by all parties, I'm not sure. You know, in the past, I think we had a very dominating governor who, we have a new governor, so it may not be quite the same process this year, it seems, but I think everyone wants to do it by April 1st.
Okay, all right. I see this note on the screen. I don't see a resolution for probation, but is there one, Brittany? Dan, you think you have a resolution to come before us?
I thought so. Again, I apologize. It was a resolution for a reappropriation of the Park Foundation grant, basically a carryover of unspent funds from 2022 to 2023. It may not have reached you in time to make this meeting.
We have a budget adjustment. Is that?
I'm looking at it right now.
I believe it was set on February 15th.
Do you happen to know the ID number, Dan? Because all I'm seeing that wasn't on the agenda was a budget adjustment and transfer for program expense.
Resolution 11509. I could resend it and we can talk about it next month.
It's okay, it's not urgent?
It's not urgent. It's a carryover of park grant funds that help us, that we manage for the drug courts. So it started out as a $25,000 grant. The drug courts spent about half of it in 2022, so we just want to roll over the other half to 2023 so we can support their programming.
All right, well, this sounds like a very exciting reason to get full attendance in April. Okay.
Sorry to interrupt. I do have it targeted to go to the legislature on the 21st. I can send everybody a copy right now if they'd like to see it. We have it in the system, but for some reason it didn't show up on the agenda.
You want to add it to the agenda and take care of it? And then okay, yeah, why don't you send it?
Okay. Actually,
can you put it on the screen?
I was going to say I can do a screen share, yeah.
Okay, let's put it up and we'll
Grab that.
legislate in real time here.
It's going to take me a second.
Thank goodness we have all these electronic things to help us nowadays.
So we're talking about $12,000 and
You make it a little bit bigger?
You want a motion to add to the agenda, Rich?
yeah, we're going to have to do that. Let's just see what it is first. Okay.
Not very long. Should someone read it aloud?
I can, if you want me to, yeah. The reappropriation of Park Foundation grant for benefit of the drug courts of Tompkins County. Whereas pursuant to Administrative Manual Policy 05-02, budget adjustments exceeding $5,000 require legislative approval. And whereas the $25,000 Park Foundation grant was accepted with resolution number 132 of 2021. And whereas a portion of the program was completed in 2022, utilizing approximately $12,448 of the grant funds. And whereas the program will continue in 2023, utilizing the remaining $12,964 funds to provide for program improvements and to support the drug treatment courts of Tompkins County. Now therefore be it resolved on recommendation of the Public Safety Committee that the Director of Finance be directed to make the following budget adjustment on his books for fiscal year 2023.
Okay. So could I get a motion to add that to our agenda? Lee moves, Veronica seconds. Any discussion on adding it? Since we're all here, all those in favor?
Mike?
Mike? There. Okay, that is unanimous. And could I get a motion on, Lee moves, Veronica seconds. All right, any questions or comments on this? It seems like we accepted the money, we've spent some of it, we're going to try to use the rest of it in '23. All makes sense. Are we ready to vote? All those in favor? That is unanimous. All right. Thanks for reminding us on this one, Dan.
Thank you. I apologize for the confusion.
Not a problem. Good, we got it done. Okay, is there any other business to come before the Public Safety Committee for our March meeting? Seeing none, I would entertain a motion to adjourn. Moved and seconded. All those in favor? We are adjourned. Thank you, everybody.